here, API convention here in San Antonio. Welcome to our viewers, welcome to our guest speakers. It gives me great pleasure to introduce Dr. Vijay Gunuganti, who is a hematologist-oncologist practicing at the Texas Oncology Center in San Antonio and also serves as adjunct professor at UT Health Science Center. Welcome, Dr. Gunuganti.
Thank you very much, Manju. I was so happy to be here.
I'm glad you came, and it's a very hot day today, but still we have so many attendees, and the conference is bustling with excellent food and the venue, and of course great speakers such as yourself.
Yes.
So your specialty is hematology oncology.
Yes,
so
it
you
is.
deal primarily with blood disorders and cancer.
Yes, you are so right. Mainly we are both deal with blood problems and cancer issues all across the board.
And a lot of times as South Asians, especially Indians, we think a lot of heart disease, diabetes, but what about cancer? Is cancer very common among South Asians?
Absolutely,
living here?
You're right. South Asians, especially Asian Indians, they are at risk of getting cancer equal to Caucasians. So let me give an example of, say, colon cancer.
Okay.
Around 250,000 patients in the United States get diagnosed with colon cancer. We think that Indians are immune. There's data showing that if you live 10 years in the United States, your risk is equal to Caucasians.
Oh.
So a lot of Indians think that cancer screening is not that important for them.
Right.
That's not true.
Really?
You have to get your mammograms, you have to get your colonoscopies and pap smears and PSAs, definitely if you live more than 10 years in the United States, because the environmental issues,
Okay.
as well as genetic issues and your lifestyle will make a huge difference whether you will have cancer or not.
So
Don't
in
just
other words,
assume.
even though for the same Indians, if they were living in India, are you saying they would have been less at a risk because of the environment, or still the risk is there?
The risk
regardless?
regardless, the risk is there.
Okay.
It's less in India, but now even with environmental changes in India, the
India.
incidence of cancer is increasing very much.
Yes,
Just
right.
like here.
I see. So not only genetics, but lifestyle makes a difference. So it's interesting, you're saying the Indians living here for more than 10 years, they kind of adopt all the risk factors and incidences of cancers like Caucasians. Indians living in India then, are they now also more at risk because things are changing there?
Absolutely, you're so right. The environmental issues have changed since the last 20 years in India as well. Before we used to think that eating a lot of fiber will prevent cancers, but now with all the genetically modified foods we eat in India,
Yes.
and so many environmental factors, pollution,
Oh, yes.
the incidence is almost getting to equal to the Western world.
Oh, I see. That's very interesting. But then the awareness may not be there as much as it is here.
Absolutely,
Okay,
yeah.
okay. So tell us now, you mentioned two particular things. You mentioned breast cancer, mammogram screening, and colon cancer, colonoscopy. Let's start first with colonoscopies, because that's the one thing a lot of people in general want to avoid.
Absolutely. yeah.
So how important is it to get a routine colonoscopy? At what age, and do you determine that age limit based on if a person has a family history or not, or do you just across the board recommend colonoscopies at an age, certain age?
Traditionally, we used to tell patients to get colonoscopy at age 50.
Okay.
Now we lowered it to 45 because we are seeing many colon cancers in age 30 to 50-year-olds since last
Really?
20 to 30 years. We don't understand the exact causes of that, but we're seeing a huge rise in young patients. Like even if you look at Chadwick Boseman, the Avengers superhero, he died at 42 with colon cancer.
That's
so colonoscopy is the only test in medicine which will prevent a cancer.
I
Not
see.
mammogram will find a cancer when you have a cancer.
Right, right.
But colonoscopy will find or prevent a polyp, and you take out the polyp, then you're not going to get the cancer.
I see.
That's why it's very important that once you hit 40, 45, you need to get a colonoscopy done. Do not think that you're immune
And
in not getting the
the
cancer.
colonoscopy is the gold standard versus you hear
Absolutely.
about this Cologuard kits and other things.
Colonoscopy is the best
It's
test,
the best test.
and Cologuard will tell you when you have a cancer.
I
don't think you want to
see.
wait until then.
So again, the prevention is the key.
Exactly.
All right. So how common is colon cancer in South Asians living here? incidence-wise?
Incidence-wise is equal to Caucasians. So because of the environmental and the diet, we still eat Indian food, but we go to American grocery stores. Is that the cause? We don't know. Is
With
there
the
any environmental
preservatives
entity cause of this? We don't know. So best is to get your screening done so that you can prevent the cancer.
Now, does diet play a role, like Indian diet? A lot of people are vegetarian. Does that help because they're not eating processed meats, especially red meat?
Yeah, sure. We have seen that the Indians who eat Indian vegetarian food, even I have seen many patients in my own clinic who's lived more than 10 years to 20 years here, they still get colon cancer. I have a few patients.
So maybe it's the quality of the food, as you said, the
Absolutely,
way it's
yeah.
processed here in the U.S.
Absolutely.
Okay, interesting. And then what about the incidence of breast cancer? You mentioned that mammogram screening, of course, we all know is very important for women after a certain age. But any difference among South Asians then in that regard?
There's not much difference between Caucasian incidence of breast cancer to Asian Indian breast cancer incidence. The reasons are, again, environmental and diet. You have to get your mammograms at age 40, beginning at 40. Do not think that Indians are immune to get breast cancer. Your risk is as good as Caucasians. So
Okay,
you definitely
I see.
need to be proactive
Right.
in finding. And recently, one of my close friends in Silicon Valley, he called me that his wife got diagnosed with breast cancer. She's 47. So you've been getting mammograms and we
Yes.
found it very early and
Yes.
we cured her.
And do you see family history plays a big role in breast cancer?
Yeah, traditionally the family history plays a very good role, but the problem is we don't know what kind of a genetic defects our fathers, parents, grandparents have. They usually used to say, hey, they died, but we don't know exactly due to what reason.
Right.
So we don't have the database of ancestry. So we have to deal with our own genetic makeup.
Yes,
And make sure that
yes.
you proactively work on the prevention of cancers and cure them early or find them early.
Right, that's great advice, Dr. Gunuganti, and I think you're absolutely right when you say that South Asians, we just need to be more aware that even though we are Indians, we still are living in the United States, and we have to, adapt ourselves accordingly and realize that we are at risk just like anyone else living here in this country, regardless of our ethnicity.
You're so absolutely right because, again, the diet, what are we doing here? There's so much data and research on plant-based diet. So there's a lot of research going on. Now the number one cause of cancer is obesity, not smoking. It just beat recently. 20% of cancers in the United States from obesity.
Obesity, any cancer or specific cancer?
No, any cancer.
Really?
We don't have a specific cancers, but we see that obesity is the biggest contributor for causation of cancer.
Cancer. Interesting,
And
very interesting
it's
fact.
an epidemic,
It is.
And
And again, related to diet, right?
absolutely, yeah.
So everything is, you are what you eat, as we
Yes,
say.
yeah.
Well, that was wonderful information. Thank you, Dr. Gunuganti, and we look forward to seeing you again on. So tell me, Raj, I know you're an ENT plastic surgeon, but there's just so much in the world now that pertains to COVID. And I'm curious to know, as an ENT surgeon, how did that impact your field, either directly or indirectly?
Yes, so as the chief of ENT at multiple hospitals in New York, I was very closely involved with COVID patients. As you know, some of the symptoms of COVID were sore throat and difficulty in breathing and taking the nasal swab, which is obviously it comes under ear, nose, and throat specialty. And apart from that, our involvement was helping patients and helping the communities during that time when nobody knew what COVID was all about.
Right.
People were so scared. As you know, you can't touch the food, bringing from groceries, and there were total shutdown in New York.
Yes.
There was no food available. Restaurants were closed down.
Yes.
Hospital cafeteria had no food.
Yes.
So we did a lot of work on the side. There were no masks available. So in New York, what we did was we created a team and we partnered with the BAPS temple as well as gurudwaras and many kitchens. And we provided thousands of meals to the hospitals that time.
Very nice.
That was actually very, very, I would say, rewarding and very fruitful, and the appreciation by the medical staff who are the frontline workers, and they were not having food in the hospitals, was very, very difficult situation.
Ah, I see.
And
Yes.
at the same time, the private physicians, as you know, there were supplies for the mask. There's such shortage of masks during that time.
Right.
And so what I did was, with my connections, we imported masks from China. They were called KN95. Obviously, they
Right.
were not absolutely top notch, like 3M N95,
Yes.
but they worked. They were very much of use. So we distributed thousands of masks, gowns, face shields during that time to our private physicians, because hospital physicians were still getting some supplies to the government agencies as well as the distribution system, while private physicians had absolute no access to these supplies. And then we worked very hard to import those directly from China and distribute it.
And that's in the U.S.
That's
You were
in the
doing all this.
US.
Any work you did in India?
Yes, we
for
did
COVID?
tremendous work in COVID. Actually, as you know, the first wave in India did not affect us as much.
Right.
But the second wave, which
That
hit
was a
India,
bad one,
was
yes.
very bad. And that time there was a major oxygen shortage in India.
Yes, yes.
So we partner with various RP chapters, such as
Okay.
Tampa chapter, Washington DC chapter, California chapter, the Cleveland chapter,
Okay.
the Indiana chapter, and also non-physician organizations such as Wills Global Foundation, Pan IIT, and we raised close to $3 million and sent more than 5,000 oxygen concentrators to India.
Oh, I see.
And
That's
that
very
was
good.
very much appreciated.
And this is
Because
your
the-
own office you
This
did
is our
this?
own
That's
office,
through your-
and
okay.
with partnership with our organizations.
Okay.
And then, thank God, the Indian government actually had given a special permission that any supplies were going through our system
Right.
would not be charged any
Duty
any courier
or-
charges and
okay.
duties.
Okay.
And that's why we could, yes,
understandable.
that was
Wonderful.
very rewarding. Then we partnered with Vikas Khanna, and he's a celebrity chef. Migrant workers, food was a big problem in
Yes,
India
it
at that time.
was. It was.
So what we did was we created the package of 5 kilo bags where there's
Oh,
rice,
I see.
dal, and then some wheat,
Okay.
and then distributed those. Almost more than million bags were
Really?
distributed by partnering with
Wonderful,
Vikas Khanna.
wonderful.
And that
So-
was also really, really rewarding.
That's great to know the efforts.
Yes.
Even though living in the U.S., you were able to impact the people in India so positively during COVID.
That's correct.
Well, thank you so much, Raj. It's really nice to visit with you again after so many years. I'm your host, Dr. Manju Sachdev. I have the great pleasure of introducing Dr. Kunjana Mavunda. She is a pediatric pulmonologist and a travel medicine specialist who has come all the way from Florida. Welcome to Texas.
Thank you.
So tell us, Dr. Mavunda, this specialty of travel medicine, I understand it's not new, but isn't it something that's becoming relatively a little bit more popular now compared to what it was, let's say, 10, 15 years ago?
Yes. So I started doing travel medicine in 1998. At that time, there were very few people that even knew about travel medicine. There's at the society that does travel medicine is a small society that has really grown a lot, because now Americans are traveling more than they used to, and around the world has opened up.
Yes.
So people are traveling all over the world. Travel medicine is a preventive and educational specialty.
I see.
It's a multidisciplinary specialty.
Yes.
So we take into consideration the patient's health, allergies, the itinerary that they'll be following, the medications that they take, and look at all of that to decide how much counseling we have to give.
I see. Before they embark
Before
on
they
their
travel,
journey.
because
Okay.
we want them to come back safe and enjoy their trip.
That's the thing. I'm so glad you mentioned the word safe, because that's the biggest fear I think most people have when they're traveling, especially when you're going somewhere like to India or far away. Every time you hear people, they say, every time I go, I get sick, or my child gets sick. So what are the precautions you think we can take? Because year after year we go, but still the same thing seems to happen.
So simple things. Food and water precautions. Generally, the rule is anything that is hot temperature-wise, it's okay to eat.
Okay.
Things that are wet at room temperature, we have to be
Okay.
careful.
Okay.
We have to remember, anytime we leave our area,
Yes.
we get exposed to different germs,
Right.
respiratory
Yes.
as well as gastrointestinal.
Right.
So when we visit our family in India, we start eating what they eat.
Yes. Uh-huh. They get offended if you don't.
Yes. And so then we're going to get exposed to germs that we're not
Yes.
used to.
Right.
So simple things that we do. Start probiotics before you start your trip.
Okay.
Probiotics are a natural product. They help boost the immune system,
Okay.
and you can increase the dose if you need to.
I see.
Taking Pepto-Bismol. First sign of a stomach upset,
Okay.
start chewing Pepto-Bismol.
Okay.
You can take up to 8 tablets a day.
Wow.
And that
Good to
helps
know.
bind the toxin and eliminates it.
Oh, I
And
see.
the important thing
Different from
also-
Imodium?
Different from Imodium.
Okay.
So we have to be very careful with
Yes.
Imodium.
Because everybody takes a box of Imodium with them when
And
they go
that's
to
where
India.
we have to be careful.
Okay.
What happens is, if you have loose stools
Right.
or stomach upset,
Yes.
you have pathogens, you have bugs in your
Right.
system
Sure.
that you're not used to.
Yes.
So those bugs need to be eliminated.
I see.
What happens with Imodium, we take Imodium
Yeah.
to stop the stools from
Stools.
bleeding.
Yes.
So then the germs that are causing the problem
Are
stay
brewing
in
and
the.
growing.
So it's nice and moist and warm and
Ah.
humid. So it's great for the bacteria to grow.
Okay.
So
So we might
Imodium
be
is the last-
symptomatically feeling better because we're not having the loose stools or loose motion, as they call it, but we're actually causing more problems.
Exactly. So the only time you take Imodium is if you don't have access to the bathroom.
Oh, okay. Like if you're going
If you're
on
going
a
to
train
a
ride or
trip where
something,
you
or a
won't
trip-
have access,
or
then you take Imodium.
okay.
But if you take Imodium, you
Uh-huh.
have to take an antibiotic at the same time.
antibiotic or probiotic?
Antibiotic. So the
Antibiotic.
probiotic is preventive. You start probiotic
Okay.
first, and then you can increase the dose. Pepto-Bismol.
Okay.
But anytime you take Imodium, you have to take an antibiotic. And the antibiotic you take has to be the correct one.
Right.
because
How would you know which one?
That's where the travel medicine specialist comes
okay.
in.
Tell us. which
Because, so for example, for India, we use Citromax,
one. Ah, yes.
but a much higher dose, not the respiratory dose, but a diarrhea dose.
Ah.
And
And
it
this is
works.
to cover the common like E. coli,
E. coli,
traveler's diarrhea,
Shigella.
Shigella. Okay.
The other thing that is really important is to put yourself on a constipating diet, like a bread diet.
Sure. So chawal, rice, dal,
Starches.
starchy foods, dahi.
And eat small. Dahi
Okay.
is excellent. It's a
Yes.
great probiotic.
Yes.
And the other thing is to eat small amounts frequently.
Okay. So not
And
heavy meal.
continue doing that for 2 or 3 days after.
After.
After the symptoms have resolved.
Oh.
Because the stomach is still sensitive.
Right.
So if you feel fine, if you had diarrhea, then you feel fine. And then you start eating. And it's like
Right.
when we go to India, we eat
Right,
a lot.
right.
If you start eating big volume, it stimulates the GI tract.
Ah, I see.
So
okay.
then it comes
Because your
back.
intestines haven't healed completely
Exactly.
yet. And of course, no dairy. That's a big thing,
Except for
right?
the
Except then.
Or-
but no
or
milk
chai.
or
Hot
cheese.
chai is
Hot
okay.
chai is
Chai
okay.
is-
Ice
but-
cream, no.
ice cream, no. Anything that is wet.
Right.
So dahi is the
Okay.
only thing allowed, and then
Right.
chai with milk is
Now,
okay.
with regards to frozen foods, I was under the understanding, or I should say misunderstanding now, that frozen food is okay or not okay to
As
eat?
long as it's cooked.
Oh, I
So
see.
frozen vegetables that are cooked.
Okay, but not like
yes.
kulfi. No.
So no, you have to be careful with those, at least initially, until you get used to the bugs there.
Okay, that's unfortunate.
So yes,
Kulfi is one of the best things.
so when we travel, we have to allow our system to get
To
adjusted,
adjust.
and then
Ah, I
everything is
see.
dose related.
Sure. Yes.
You eat a small amount to
Yes.
get used to it. It's like a vaccine. You eat a
Yes.
small amount, you get used to it,
Inoculate
then
yourself.
you take not something new
Suddenly.
at the same time. So it might
Yes,
take 3 or 4 days
Sure.
to be.
And of course, people think, oh, salad is okay, but salad is washed in water.
And it
that
requires
contain-
food handling.
food handling. So anything,
Anything
like
that requires
So
food
these are
handling.
some good tips. Now, what if when you come back home, and a lot of people say, well, I was fine there. As soon as I got home, I became sick, especially respiratory things. What do you advise those people to do?
So one thing that people don't remember about is jet lag.
Yeah.
Jet
And travel
lag
is so
and-
long.
And the long travel.
Yes.
So people get dehydrated.
Oh, yes.
Remember, if you have a
Right.
12-hour flight,
Yes.
the air in the cabin is dry.
Oh, yes.
We try not to drink much so we don't have to use the
Right.
bathroom on the plane.
Right.
And
So
we get
that-
dehydrated.
we get dehydrated.
And then you have the jet lag. It's many hours time
Yes.
difference.
Yes.
So when a traveler calls me within the first 24 to 48 hours, it's
Mm-hmm.
usually just that they need to rest,
Right.
drink plenty of fluids,
Okay.
and get used to the time difference.
Okay.
Respiratory is the next thing that can be a problem. And I guess one good thing about COVID is that now we're cautious about our hand washing and wearing masks.
Right.
But you can get respiratory illness in the plane.
Oh, in the plane.
And then the other thing people sometimes forget, when you're in India, let's say, you're careful about what you eat.
Yes.
And then you get on the plane to come back to the US. And you'll think, oh, now it's
Now
safe to
I'm
eat. I
safe,
can
but you're
eat.
still getting the things from India.
Exactly. And
Transported.
that happens.
That has happened actually personally to me. Yes, I can relate to it. Those are excellent points. I think that, the suggestions you give now, so should a person go visit a travel medicine specialist such as yourself, or would their primary care also be able to advise them about these things and give them the Zithromax and probiotics, whatever they need?
Ideally, they should see a travel medicine
Okay.
specialist at least 3 to 4 weeks before, about 30 days
And you also
before
will
they
administer
leave.
the necessary vaccinations.
And that's the point, that
Okay.
there are sometimes it takes time for the vaccines to become effective. So
Sure,
ideally,
sure.
you should see the doctor, the specialist 30 days before. But if you have a primary care physician who knows what they're doing, that should be okay. Unfortunately, I've had patients that have gotten the wrong medication for malaria or the wrong
Right.
antibiotic or the wrong dose. And sometimes people go to pharmacies to get vaccines. They'll look up on
Right,
the
yes.
internet to
The
see what they
pharmacies
need.
offer that, yes.
So they go to the pharmacy to get the
Right.
vaccines. And then there are so many different types of vaccines now
Yes.
for different diseases.
And certain regions cover some, and certain regions you don't need them.
Yes, and so for example, hepatitis A and B vaccine, you have a separate hepatitis A vaccine, separate hepatitis B vaccine, you have a combined vaccine, and the traveler goes to the pharmacist, and the pharmacist might give the wrong vaccine, or might not get enough immunity. So.
There's so much, like you were saying, that seeing a travel medicine specialist is essential because you get specific details pertaining to which country you're going to, which illness you need to prevent, and which vaccination is needed.
And what your itinerary is, where you're
Itinerary.
staying,
Right.
and what sort of activities you'll be doing.
Well, that's another issue.
So, for example, insects, mosquitoes.
Oh, yeah.
There are mosquitoes that like being around humans, that have a specific affinity to humans. If there's a dog and a human, they'll bite the human because they like humans.
Okay.
These mosquitoes transmit things like dengue, Zika,
Malaria.
chikungunya, malaria. And there's not much you can do about certain diseases. So it's very important to get information about avoiding insect bites. And there's a lot of misconceptions about that as well.
Yes.
People think that citronella or neem is effective.
Yes.
They are effective, but very short term.
Okay.
They might be effective only for about an hour or so.
Okay.
But then there are other products like 20% picaridin or 30% DEET
Okay.
that are effective for about 12 hours.
So someone would
And-
need to take a good amount of that, like, to protect themselves.
Yes. And then there are concentrated, like there's a formation of DEET that is on a liposome that you can apply, and it lasts for a long time,
Oh.
and it's not a big container.
And some are
there
even combined with sunblocks, right? So is
Yes,
that,
but
how
those
would
are
you think
not
of those?
those are
No,
not
not
recommended
effective.
anymore. In fact, I think they've stopped making those already.
Oh, okay.
If you apply sunblock first, and then the insect
Okay.
repellent.
Okay.
Also, if you're going to be spending a lot of time outdoors or going on safari, then you may want to consider spraying your clothes with permethrin.
Oh.
Permethrin is a chemical that you spray your clothes with before you leave. The permethrin stays on the material. It's good for 6 washes or 6 weeks. And the nice thing about it is that it also kills insects. So if you have clothes that are covered with permethrin,
Yes.
then you have very little area that is exposed to insects.
Oh,
That way
I
you don't have to
see.
use so much repellent.
Oh, okay.
So you-
What about in children? Is it safe to use these products?
So yes, and that's again something to be careful about. In the market, in the stores, you get DEET that is 90%.
Right.
And it doesn't say that it's not for the body. So on the body, even for infants, you can use up to 30% DEET,
Okay.
and it's safe.
Okay.
Picaridin may be safer for
Okay.
children.
Okay.
And then you can reapply if you
And
have to.
permethrin? No, that's just for the
Permethrin is for
clothes.
the clothes.
Clothes. Okay. Okay. And these are available readily at the pharmacy? You just go and buy it over the counter, or do you need
You
prescriptions?
can get it over the counter. Even stores like Home Depot have
Oh, okay.
it. But best place is Amazon.
Oh, okay. Well, it's good to know. And you can use either one of these products, or do you need to use all three?
No,
or
no.
Either one.
Either one. Permethrin is specifically for the
For
clothes.
the clothes. So
Which-
either
so
the
that-
DEET or
yeah.
picaridin. Okay. Okay, that's very useful information. People underestimate how important it is to avoid these vector-based illnesses. They think, oh, I'll get cut by a mosquito bit. What's the big deal?
And
I have
that's-
malaria prophylaxis, but there's so many other diseases that
Right, and
are
that's what's
possible.
unfortunately, like this year,
Right.
for example, in India, we've had the heat wave,
Yes.
and then we've had the floods and
Yes.
all that
Oh,
rain.
a harbor for
So whenever
mosquitoes,
you
yeah.
have heat and rain, you're going to have more mosquitoes.
Yes.
And then remember also that there are diseases that are spreading, diseases that we did not see
Yeah.
before
Right.
are spreading. So
Right.
the more exposure you have to insects, the more chances
Yes.
of different diseases showing up
Yes.
where people don't have immunity, and that
Right.
can be a problem.
Absolutely. These were excellent talking points. Thank you so much, Dr. Mavunda. It was a pleasure talking to you, and next time we have to travel to India or anywhere else, we'll come and see you for advice. Thank you.
Yeah, what's your name?
Dr. Kunjna Mavunda,
Miami,
From Miami.
Florida.
Correct.
And what's your specialty?
pediatric pulmonology and travel medicine.
Thank you.